Good afternoon. The Health Services Committee will now come to order. I am going to ask members to introduce themselves again because we don't meet quite as often as other commissions. So for audience members who are just joining us, you may find it helpful. So we'll start at my far, far right with Dr. Hundley.
Yes, good afternoon, Madam Chair. My name is Dr. Greg Hundley, and I am the Director of the Poly Heart Center at VCU and VCU Health.
Dr. Lisa Kuhn, State Superintendent of Public Instruction.
Hi, Becky Bowers-Lanier. I am a nurse. I'm here as an advocate.
There we go. Mark Peak, State Senate District 8, Lynchburg, Bedford, and Campbell County.
I'm Senator Barbara Favola, and I represent 95% of Arlington County. My entire Senate district is contained within Arlington County.
I'm Delegate Mike Cherry. I represent the 74th House District, which is all of the city of Colonial Heights and the southern tier of Chesterfield County.
Good afternoon, Delegate Winter Walker, House District 52, City of Lynchburg, and part of Campbell County.
Good afternoon, Delegate Laura Jane Cohen, representing HD 15, which is in Burke, Virginia, entirely in Fairfax County.
Thank you, members, for taking time out of this busy holiday season to participate in the Health Services Committee. I will ask the clerk, by my count, we do have a quorum. Is that correct? Thank you. Okay. All right, colleagues, I will turn your attention to the packet that's before you in the yellow envelope. Before we head right into our formal agenda, I am going to ask Ryan Brimmer, who is graciously staffing our committee. Mr. Brimmer is an attorney with DLS, to give us an update on Elizabeth Bennett Parker's bill. We had approved it in concept at our last meeting, and we asked for some tweaks to be made. So, Mr. Brenner, go ahead.
Yeah, thank you, Madam Chair. The copy of the updated bill is in your packet for review. Just two small changes to the bill requested by the committee at its October meeting in concept have now been incorporated into the bill. So just wanted to point those out very quickly. First one is on page 15, that new language on lines 377 to 378. The committee pointed out that the bill was kind of missing a hook between this newly established permission to administer the nasal seizure rescue medications and the existing code section on seizure management and action plans for specific students. So we did incorporate the reference to that in the new language on lines 377 to 378. And then the only other change to the bill was at the very end, the last page in the second enactment clause, just having the Department of Health and Department of Education update the school health guidelines to provide guidance on the implementation of the Act.
Thank you, Mr. Brenner. I just want to remind my colleagues that the context of this bill, it is permissive regarding whether school boards should adopt a policy or not, but if they do adopt a policy, we lay out what needs to be in that policy. I'm still very comfortable with it. We voted at our last meeting again to endorse in concept. So unless anybody has any other issues, I'd like to just reinforce that the committee is now happy with the amended version. So Delegate Cohen, if you'd be so kind as to make a motion.
I'm happy to make a motion to support this in its most recent form.
Thank you. Is there a second?
Second.
Okay, motion has been made and seconded. All those in favor signify by saying aye.
Aye.
Aye. Okay, so I will relay our endorsement to Delegate Bennett Parker. I'm going to walk us through the review of our 2025 legislative and budgetary proposals with the hopes that we can take action if it is the will of the committee. I guess the first item on our agenda is a bill to extend the committee statutory sunset date. I feel that we still have more work to do, and I would be in favor of extending our sunset from July 1, 2025 to July 1, 2028.
So we need to move that.
Yeah. Okay. Thank you, Delegate Cherry. Second by Senator Peak. All those in favor of extending our sunset date signify by saying aye. Aye. Does anybody wish to abstain or vote no? Hearing none. Okay, that passes unanimously. There are two items under item 2, which says budgetary, but they're two separate requests here. One, we talked about at our last meeting, and that was an amendment, budget amendment, to set aside $150,000. It would be each year of the biennium as part of our overall nursing scholarship. So this set aside would be available to LPNs who are working in schools and they're going for their RN. And the requirement would be for every scholarship year, where we'd be expecting a $10,000 grant for each scholarship year, the student would, after graduation, have to work in the school system for a year. This is something we talked about at our last meeting. It is not a new budget amendment. It has been proposed several times, and I know Senator Hanger proposed it a few years ago, but it's something that I think would be very helpful and provide some continuity for our schools, provide an incentive for our LPNs to get an RN, and these are folks that have to be working in a school setting. And I am willing to put in this as a budget amendment, if it's the will of the committee. And if there are any questions, Mr. Brenner can respond. If I have left something out, please feel free to add to my presentation.
Do we need to second or move?
Yeah,
that?
I need a motion.
Move that one.
Okay.
Madam Chair?
Senator Peak made a motion. Dr. Hundley?
Yeah, just wanted to, do we have an idea of how many there would be? Because this looks like this would help 15 per year, but in consideration of many of our counties, particularly in rural parts of the state, do we think 15 is enough? Or I just wondered why we picked 150.
The 150 was selected because it was the amount that had been submitted for several years to the Budget Committee. Mr. Brenner, I don't think this ever passed, though, in the budget. Is that correct?
That's correct, Madam Chair. And so the data we received from the Department of Education, again, this is a couple of years old, so it might be a little bit different now, but it was that there are 279 full-time LPNs working as school nurses. I believe that was 22, 23 data. So yeah, the 15 would kind of address a portion of that 279.
But not the full amount. Committee Member Moore?
I mean, that would touch such a small amount. It would take years and years to even make an impact. I mean, that's less than 10%. That's like 5%, if you look at the whole piece. So if we're trying to do anything to actually get a school nurse, a registered nurse in our buildings, that would take 20 years, I guess. 5% of the nurses or less. So I don't know that that's.
So you would
it's not generous. I mean, I guess it's a start, but I don't think $150,000 is really anywhere near enough. Just because it hasn't been touched before, I don't think it's been advertised before. So if school nurses didn't know about it, they weren't able to go and access it.
They would be eligible for other nursing scholarship programs, but they wouldn't necessarily be tied to continuing their professional career in a school. So when you look at it in that context, but I am willing to amend the $150,000 if you think we should.
I think if it's going to make an impact to keep them in the schools, which is the whole point, we need to keep them there because, we value them. We need them to stay there. You know, we do believe that we need nurses. We would love to have them go into an RN position if we can help them do that. You know, if we can even get some kind of a program with our community schools, you know, with our colleges that are community related, that would be wonderful. I don't know how we go about doing that. I guess DOE could kind of work something out, or if, you know, VASN could work something out, or if even the nurses who have their nationally certification, you know, we could do something like that. That would make it easier for the school nurses and the LPNs trying to get that. I think those are all workable things, but it would definitely be more than $150,000 because that's going to take 2 years for them to do that. If we want them to stay in their jobs while they're doing it, you know, it's going to take a little bit more time. Be totally worth it for those nurses and for our students.
Thank you, Madam Chair. And yeah, I understand why you put that amount in as just picking an amount that you would hope could actually get funded. I don't think by picking that amount that the chair intended to imply that this was going to satisfy the problem or that this was enough in any way. I think the intent was to get something started, anything. And so we might as well ask for more and see what happens. So maybe we should double it to 300,000 and see, knowing how hard it is to get any money into the budget. But this is one of those areas that we definitely need to address. And the General Assembly keeps talking about mandating full RNs at every school, or at least an LPN at every school. So I think this scholarship approach is a great way to do that. So I'd move your request to 300.
Okay.
Or move to amend it however you want to.
Okay, thank you, Senator Peake. Is there a second? Okay, Delegate Cohen seconds your amendment. I think that's prudent. I will do my best. We'll see what happens. All those in favor of adopting this budget, endorsing this budget amendment that is now at $300,000, signify by saying aye. Aye. Is anybody wishing to oppose or abstain? Okay, seeing none, that endorsement passes unanimously. Now we have another budgetary related amendment. And this is the second paragraph, and it's an amendment to provide, and we left the dollar amount blank for the moment, but it was a grant program to be established and administered by DOE in collaboration with the Department of Health to provide grants on a competitive basis to school divisions in which any public elementary or secondary school is not staffed by a full-time registered nurse. We want to give preference to high-need schools, such as our Title I schools, our rural schools, or our hard-to-staff schools, or based on an analysis of social determinants of health. This was one way I think the committee talked about where we can try to make progress in getting a registered nurse in every school, and looking at areas which really are underserved now from a healthcare standpoint. I think strengthens our argument. I'm not sure what amount to put in. I was thinking 2 million, but I'm open to suggestions. Maybe that's just. Oh, yes. Okay. Delegate McQuinn.
Thank you. Madam Chair, just a question. Why are we, if you look at the amendments or asking, why are we not, asking for, doing one ask, but it would serve two purposes? Or do we need two different amendments?
We were thinking there were two different programs. One is related to a scholarship program that already exists.
Okay.
So that's the first one, which is why we had to separate it out, because it already exists. This, the one we're talking about now, does not exist. It would be brand new.
Okay. Okay.
I
think, Madam Chair,
yes,
I think one of the other things, and I was just sharing with my colleague here, that in talking to several of the hospitals and talking to some other individuals who's in that nursing field, there's a lot of discussion on the shortage of nurses, in the health field. That field is just, so many are missing. And we certainly going to have to take the initiative, and this may speak to some of it, to try to provide support so that hospitals are staffed, schools are staffed, those various places where nurses seem to be missing in action, to make sure that we have those individuals there that we need in that health field. So I would, whatever we can do to help make it happen, I think this would be great, because I'm sure it's going to be some competition as well, whether they want to work in a school or work in the hospital. And whoever puts the most money up often, even though there's a passion for this, but they'll be the places that they'll go.
Yes.
So, thank you.
Fair enough. Thank you, Delegate McQueen. Mr. Brenner, do you have any sort of analysis or framework to sort of help us with a budget amount, other than we know there's a big need?
Madam Chair, I am not a numbers person. I'm a words person, so it's whatever the will of the committee is, and I would commit to helping you, whoever decides to carry this budget amendment, to work with the Finance and Appropriations Committee staff to come up with something that would be reasonable. If it's not the will of the committee to pick a specific amount right now, but rather to leave it with the budget amendments sponsor.
I guess I'd be inclined to pick a number and then maybe just amend as needed. Is that, unfortunately, I don't think it's going to be amended up. Yes, Delegate Cohen.
I wondered, I certainly don't want to put Superintendent Coons on the spot, but I wondered if maybe she might have any guidance for us in looking at, a school nurse. I know that the pay varies pretty drastically, but is there some sort of median pay that we pay them in our schools?
I would have to go work with the team and get back to you. I don't have any of that information right now. I chatted them about a few things, but I think they are on a call with the counselor advisory group, so I can't give that to you right now.
That it does vary drastically. In some areas, they get paid the same as a clinic assistant or a paraprofessional, even though they're working as a nurse. And in other districts, they're pretty fortunate that they get paid similar to what nurses in hospitals get paid. We're trying to get it bumped up where everyone gets paid like an actual nurse gets paid, for their degree and for the work they're doing and the responsibilities. But unfortunately, it's not that way across the state at this time, so it will be variable. There are some information that is collected at the end of each school year from DOE. You might have that. I know they do have that to let you know which schools have, RNs versus LPNs versus, just paraprofessionals or instructional assistants, clinic assistants, whatever you want to refer to them to, in their clinics working. So they do have that information from last year. We just have to get that collected from them.
I'll go. No, ma'am. So I am not comfortable plugging in any kind of money into a grant program until we have more research and more information. I think that's vital to making good decisions here. I mean, we're accountable for the taxpayers' money. And then not disputing the need is very important. But we're coming in and just start plugging in money here and there. And of course, we would have got to go through the budget process and all that. But I would like, if in the future, if we could come back with more information. And as you've indicated, that the salaries vary, whether it's Northern Virginia or Southwest Virginia. So it's helpful to us to have a better understanding of what those specific needs are. And going forward, then we can start attaching maybe some budgetary funds to that. But, I'm not in favor of supporting anything with just a blank check right now. No, thank you.
Of course.
Senator.
But it seems like maybe we should just put in a smaller figure then to cover the study. Like,
I was going to make them do it without any money.
without, do you
But
want to put this
I'll
amendment?
ask Dr. Coons. Dr. Coons, do you need money to evaluate what we should do going forward for Title I schools who need nurses?
I would always say it's good practice to make sure we have staffing support, given the number of reports that the department already.
How much money? I mean, do you have to hire a consultant? Would 150,000 be okay?
I think we will be able to be okay.
Let's put 100. I think 100 ought to be able to cover it. Madam Chair, I'd just say let's put in a figure of 100,000 just
This is
to
just
help
for
the
the
study. Yeah, the study of the grant program and whatever to get it
To
going.
come up with a
Proposal.
the outline of a
Yes.
grant program and a proposal.
I don't think we need 100.
All right. We have to put in 50, because what if it's below 50, if it's above 50, put in 75 then.
Okay.
Let's put it, yes, fine with me. Let's just put something in so they don't say, I don't see a budget amendment for this, so we can't do it.
Colleagues,
Yeah.
where we seem to be Thank you. Colleagues, where we seem to be heading is that language would go into the budget with a small amount associated with it, maybe up to 75,000, directing the Department of Education to come up with a grant program that would help fund the confines, the framework, if you will, of a grant program to enable us to move forward funding RNs in Title I schools. So we'll have a recommendation to act on in 2026.
I would feel more comfortable with that, and.
Okay, I would
Senator
too.
Peak, what was that amount again?
75,000.
You're mighty generous today, but I'll go along with that.
Okay, well,
That doesn't mean it's in the budget.
No, I understand. That's
Del-
another.
Delegate Cohen,
I just wanted to make sure, Madam Chair, that in addition to Title I, that we still were keeping that language for rural or hard-to-staff schools.
we are.
Okay, perfect.
Yeah. So it's essentially this language turned into a directive to the Department of Ed. Okay. Yes, Becky Lanier, yes.
I
Bowers
just wanted
Lanier,
to
yes.
add, to make sure, I didn't hear in your original language, but I think you mean this, that we would like to have the study be evidence-based, focus on the data that currently exists, as you mentioned.
Right, and that's not the same study information that we were already supposed to be looking into, because I thought originally
This is different. This
okay.
is,
We already have a lot of information from like 3 other studies. I just wanted to make sure that it's not the same information we're going to study again when we already have information
no,
from other
this
studies.
actually isn't as much of a study as the directive to develop a grant program and what it should look like, what schools would be eligible, given our interest in serving underserved populations.
Okay.
Looking at existing data. about-
Correct. Looking at existing data, we'll probably ask for a report back, I don't know, in November of 2025. Okay? All right. So now that we've got this just about written, I probably could use a motion.
So moved.
So moved. Okay, Senator Peake made a motion. Is there a second? Second by Delegate Cherry. All those in favor signify by saying aye. Aye. Does anybody wish to vote no or abstain? Hearing none. Passes unanimously. Thank you, colleagues. That was a little bit more in detail than we had originally expected. Okay, so we have gone through the issues that the committee has previously looked at. And we've positioned ourselves now to articulate endorsements as one of us goes forward with budget language or other language. Next on our agenda, though, is the emergency. There's a cardiac emergency plan bill in front of us. This is item 3. It would be Senator Rouse's bill, and I will ask Mr. Brenner to explain that.
Yeah, thank you, Madam Chair. Just for context, at your last meeting, when you were setting your work plan for 2025, you decided that you wanted to take a deeper look at cardiac emergencies in schools, but recalled that Senator Rouse did have this bill last session. It made it through the Senate, and it was continued to 2025 in the House Committee on Appropriations. And so you just wanted to take another look at the contents of the bill in the lead up to looking at this concept more holistically and deeply. Next session, so just very briefly, this bill would have required each public elementary and secondary school to develop a cardiac emergency response plan. And then it set out several requirements for those plans, including establishing a cardiac emergency response team, activating that team in response to a sudden cardiac event, and then integrating the plan into the local community's emergency medical services response protocols. And then the bill also set up a grant program to support the development and implementation of those local plans. And Senator Rouse did carry a budget amendment in the amount of $260,000 to support that. But the budget amendment also failed along with the bill. So that was the concept in a nutshell, Madam Chair.
Thank you so much, Mr. Brenner. Colleagues, this bill came before us last year. It was referred to the Finance and Appropriations Committee in the Senate and probably the Appropriations Committee in the House. It could be separated, though. As I understand this, Mr. Brenner, we could require schools to come up with this cardiac arrest plan, and then the funding would be a separate issue. Do you view it that way, or am I incorrect in that?
Yeah, Madam Chair, that would be a perfectly acceptable approach. Yeah, we would just take out everything in the new code language about the grant program and just require the plans.
The other option is keep it as is, and the appropriators can decide to take out the, or change the request for a grant program. So we can endorse it as is with the grant request and let the appropriators determine if that's the proper amount. Yes, Delegate Cherry.
Thank you, Madam Chair. I, being from local government before I came up here to the State House, to the big house, one of the things I promised my constituents back home is I would not vote or support an unfunded mandate. So if we're going to say they have to have the plan, I believe we should fund it as well. So separating the two out and doing it in two different things, I would be opposed to that. If we're going to put it through, I say we put it through as with the money, with the requirement to do it. And that would be my rather in all of this, but that's just because I have an aversion to unfunded mandates.
I appreciate that, Delegate Cherry. I agree with you. I do want to be clear, though, the amount, I don't think it guarantees that every school system would get it. Yeah. Is that correct? So the school systems would have to apply. It's not going to be a pass-through. But I would, like you, I would be cautious about passing something that was a mandate that didn't have some money associated with it. Delegate Cohen?
Yeah, I agree. The folks back home think that once you spend 4 years in local government, you ought to never vote for an unfunded mandate again. But sadly, that's not how this works exactly. But I agree with both of you that I think keeping these together is appropriate. However, I wondered if we might be able to send back to Senator Rouse just a comment that I think the device money is great and appropriate, but what we find in our school system, and I know school systems throughout the Commonwealth, is the lack of personnel who can be at, these are most likely to happen at athletic events. And so, you know, we have so few systems that are able to afford athletic trainers, and particularly athletic trainers that can be at these large countywide events that we have in many places, multiple counties who compete at these events. So that would be my fear. Is it's awesome to have the device, but we really are in a place where horrible to have the device and not have somebody who can utilize it. So I think I would really appreciate as a committee if we might be able to make a recommendation or however you see appropriate, the idea of adding some budgetary money in for athletic trainers.
I think that's a very good, I think that's a very good comment. I'll ask Dr. Coons, does the state offer a curriculum for athletic directors on the different types of training, like this cardiac response?
I don't think we do, but I can check into that and find out. Most of the athletic programs are governed by VHSL, but I can certainly look into that.
Okay. Yes, Becky?
One of my clients is the Athletic Trainers Association, and they all have this in their undergraduate and graduate curriculums. So I think that would be, that's probably not the issue of, if there is an athletic trainer in the school, that person would be trained in the emergency response system. So, and I can't tell you the number of athletic trainers. Not all schools have them, but of the schools that have them, they are trained in this area.
The ones.
Yes.
This does not necessarily limit a school employee to the athletic unit in terms of coming up with a cardiac arrest plan. I'm just wondering if it might be helpful to suggest to Senator Rouse that we add language, maybe directing or specifically including that athletic trainers be a part of this or be tasked with this.
Madam Chair, that is part, I believe, of subsection 6 on line 44. 45 is where the athletic trainers are included.
It says ensuring periodic training in first aid, CPR, and the use by appropriate staff, including school nurses, athletic trainers. So I guess that does cover, would you say that covers the issue, Mr. Brenner?
Yeah, Madam Chair, certainly on the training, they would have to have a plan to train in that way. If I understood Delegate Cohen's suggestion, it was more along the lines of actually hiring the athletic trainers. So I think that we could, if the committee were to endorse this bill and one of the members were to introduce it in the 2025 session, and it was the will of the committee, we could add the hiring of athletic trainers as one of the permissible uses of the grant funds. I think it would probably be one of the more expensive items in that list, but I think if that's the will of the committee, we could do that.
Yeah, I'm not sure exactly where you were heading. I thought you were heading towards the training. Delegate Cohen, are you?
No, I was thinking of the idea that we know that all of these people can be trained on our staff, and athletic trainers are certainly one of those, but that the athletic trainers are the ones who are most likely to be on the field and be able to very quickly engage in utilizing an AED. So my hope was that, knowing that every school system, every school, high school in particular, does not have these across the Commonwealth, that we might be able to establish some sort of fund for high schools to be able to hire athletic trainers if they didn't have one.
It's an interesting concept and probably a need.
And
yes,
just another thought to think of is, even if we have the AEDs in the high schools and on all the buildings, with the athletic trainers mainly being in the high schools, we have multiple activities going on in schools at the same time. So there's just one athletic trainer in the high school while there's multiple events going on. And also the AEDs we have in the buildings, they're locked in the buildings. They're not out on the fields typically, because you have to have a different kind of case that's temperature controlled for those AEDs. So if something's going on out on the field and they're locked in the school, you can't even access those typically. especially in the middle schools and the elementary schools, because they're locked up in the buildings a lot of times for evening or, Saturday, Sunday events. So that's another, twist to the whole thing. And those type of outside storage for the AEDs are quite expensive. So there's a whole lot of different dynamics that goes to the whole thing, even if you have somebody trained, whether they'll have access or if that one athletic trainer's there that day or if they're on a, an away event or something. It gets really complex.
And
I think this just might be a good entryway, and maybe the next go-around, we would get to Delegate Cohen's point. Senator Peake?
Yeah. Madam Chair, I guess a point of clarification. So this was Rouse's bill that
Yes,
was referred to us, correct?
correct.
Carried over. So what do we?
He is
what
going
do-
to be introducing it again, and so the
And so
question
what-
is whether we should endorse this bill this time, and I think I am in favor of endorsing it.
So
and
we
I-
don't really need to make changes or anything at that point
No,
right
but
now.
we could endorse in concept with a recommended amendment, but it seems like he's covered everything, and it has been looked at already by many lawmakers. So yes, you would be fine making a motion to endorse.
And then we can, whatever comes up in committees, whatever changes. So I would just move to pass it like he's got it right now, and then
With
we'll
the-
see
with
what
the
happens in
Okay.
session.
Okay, a motion has been made to endorse the bill before us with the budget amendment. Delegate McQueen? Oh, second, okay, great. Motion has been made and seconded. All those in favor signify by saying aye. Aye. Anybody wish to vote no or abstain? Hearing none, that passes unanimously. Thank you, colleagues. Okay, this brings us to public comment. I feel like we've moved along quickly. Mr. Brenner, is there anything more we should discuss before public comment?
Madam Chair, not that I'm aware. I guess just a point of clarification for the budget amendments. Did you want to set patrons for those now, or just wait and do that after the meeting?
Madam Chair.
Senator Peake?
Yeah, Madam Chair should be the patrons.
I will be contacting lawmakers after the meeting, and you may contact me. You may come to me. So thank you, Mr. Brenner. I just want to note on the Senate side, if a bill has been endorsed by a commission, it does not count against your limit. But I will say that the bills we've looked at, with the exception of the budget amendments, do have patrons. So we don't have to worry about that. And they, of course, are going to make it very clear to the authorizing committees that they've earned our endorsement. So thank you, Mr. Brenner. Okay, we will move to public comment. Do I have a list? I do not. Okay. I believe this gentleman is with the Cardiac Association. Am I? Heart Association, yes.
Madam Chair, members of the committee, I'm Gonzalo Ida with the American Heart Association here in Virginia. I just want to point out that we really appreciate the conversation that the committee held this afternoon on the cardiac emergency response plans. Obviously, the American Heart Association does strongly support the idea of implementation of cardiac emergency response plans, and we very much look forward to working with all of you when the session comes in January on a legislative solution on that. But we do want to say we really appreciate the conversations and the items that were discussed here today. So happy to answer any questions that members of the committee may have, but otherwise I'm always available. Thank you.
Thank you. Is there anybody else in the audience wishing to speak?
Good afternoon, Catherine Haynes with the Virginia Interfaith Center for Public Policy. I always have to say something. So first, I just wanted to really thank you for the unanimous support for the LPN to RN pathway, and was excited to see the doubling of the amount. So that was significant, and thank you. And then with the extension of the committee going forward, I think it would be great if all committee members were presented with the results of the FOIA to DMAS that I did, looking at the school is currently billing, it's the one I talked about last time, the school is currently billing Medicaid for nurses and school-based services, just to sort of look at what districts, I mentioned that the number was very low, right out of the school, I think it's 132 school divisions, about 40 were billing Medicaid, so digging into the names. And those of you might find it interesting to look at who is and who is not and explore the barriers. Thank you very much.
Thank you so much. We will put that on our list of things to do for our next year. We will have a work plan as well. I expect we'll meet right after session, colleagues, to continue with our work. Are there any other speakers? Is there anybody on our virtual platform? Okay. Is there any other business to come before the committee? And this will be our last meeting prior to session. Okay, hearing none, I will accept a motion to adjourn.
So moved.
Second, all those in favor, you can signify by saying aye. Anybody who wants to vote no may come and talk to the chair.
They can stay as long as they want.
The Senate of Virginia, Richmond, Virginia.